Castlecraig is an addiction treatment centre. Castlecraig was founded in 1988 by my family. It's based in the south of Scotland, just half an hour from Edinburgh. We have rolling hills and forests, which all contributes to the therapeutic environment that we're trying to create. The reason that we're designated a hospital is because of the high standards of nursing and medical care that we provide. We can treat more complex cases than other treatment centres, but it also means that we can provide the highest standard of nursing and medical care to every patient who comes into treatment. Addiction is fundamentally the toughest challenge that anybody can ever face in their life. The admissions process will begin with a phone call. We go through a process of pre-admission screening and discussion. So it's our job to listen to the story they come with. We'll be welcoming that person into treatment with a full understanding that we're the right place for them to come, and to begin the process of presenting them with options and an understanding of the best way forward.
When somebody first arrives at Castlecraig, they will be given a medical assessment by the nurses and by the doctors, and then within the first few days of their treatment, they will be having a conversation with their therapist. Our pre-admission team does the screening and interviews, and then they pass the information on to the therapeutic team, and the therapy team will then look at who is the best fit for the patient.
Castlecraig is a really special place. We have 35 years of history, and one of the things that makes us unique is that we are a regulated, registered psychiatric hospital.
Detox is something that we're very experienced with managing at Castlecraig. Our medical team are not only accredited and qualified, but they have years of experience in the field of addiction and work with some of the top journals publishing evidence-based research in the field.
We refer to our treatment as holistic, and each part of treatment corresponds to a different part of the person. The 12 steps are a program that people follow in their day-to-day lives. It has also been modeled into a type of therapy that can be facilitated with a therapist. And it involves a process of looking at every area of life, from your relationship with alcohol and drugs, to your relationship with your friends and family, your relationship with your higher power, and your relationship with yourself.
We have a number of therapists specialising in cognitive behavioural therapy. Most of our therapists have done additional training in DBT, which is dialectical behavioural therapy, and there are some of us who are accredited in EMDR and trained to administer EMDR.
We also have lots of group work, lots of one-to-one therapy. We also have alpaca walking and equine therapy. They're very successful in helping people.
The patients tend to sleep better as well after these therapies, like say the oxygen therapy. My own vision of recovery is one of truth. This is very much evident here at Castlecraig.
After treatment at Castlecraig, we have what we call a continuing care and aftercare plan, so that patients' treatment can continue.
The recovery journey really begins when it's time to leave, and their recovery is now fully self-directed. All of that culminates once a year at our annual reunion, when we put up a huge marquee in the grounds of Castlecraig. We have a residential treatment centre in Scotland at Castlecraig, Marble Castle in Ireland, and we have outpatient centres in London and in Stockholm.
Seeing people get well when they leave, it is amazing to see that difference.
It's a mental, emotional, physical, spiritual change in a person.
One of the most inspiring parts of what we do is seeing this transformed person who is often smiling and happy, excited, positive about the future, ready to lead a life in recovery.